Hello everyone, welcome to the Team TDF Wellbeing Webinar. My name is Irena and I am one of the practitioners at TDF and I am an acupuncturist. Today I am going to show you a routine that can help you lower high blood pressure. So please follow me if you can reach. I tried to make it as available to everyone as possibly I could. But if you don't feel comfortable reaching to some points, just don't worry about it. I am going to show you 5 points today. And if you can't do all of them, it is fine. The other points may have the needed effect. Remember, all of your videos and microphones are switched off. No one, including me, can see or hear you. There's no communication between us right now. TDF is a charity that relies on donations, so please give what you can. Make yourself comfortable and minimize any distractions like turning your phone into silent mode. Have a glass of water if you want one. Anything that will make you comfortable and allow you to just be with me comfortably for coming half an hour. The guided part of the session will last 20-25 minutes, and I will talk you through what we are doing. At the end, I will repeat again, show you again the points, and I hope you will enjoy the session. Do close your eyes if you feel like doing so. Please remember to participate accordingly to your own abilities. If you are not sure about trying acupressure for high blood pressure, one session most likely won't make much difference. But if you stick to the routine and decide to do this daily and you have high blood pressure and take medication for it, then I encourage you to check your blood pressure daily at the same time, ideally, of the day. And if you notice that your blood pressure is getting lower, please see GP about it because your medications need to be adjusted. Different dose. This session will end by 12:30. If you have any questions after the session or want to get in touch, email us at the therapy support at tdf.org.uk. So now we'll start our little exercise. The routine, as I like to call it. So the first point that we are going to try is located on the elbow. When you flex your arm, making like 90 degrees, it's located at the end of the crease, transverse crease. It's right here. So this is point large intestine 11. I will measure the time. We'll press each point for 2.5 minutes. You may start already. So again, flex your arm and at the end of the transverse crease, this is the point. Large intestine 11. So it's good for lowering high blood pressure. Just try to press as gently and as hard as you feel comfortable. You may continue on pressing, or you may kind of stimulate, press and lift, press and lift, press and lift, or do circular motion. Just continue on pressing. Make yourself as comfortable as possible. I am not in the best position, but I am just trying to show you what to do. You may rest your arm on your shoulder and press, or rest on the armrest. Let's keep it for some time, pressing. In general, acupressure, can be done to anyone. It hardly ever has any side effect, and side effects include bruising or just a mark. If you have longer nails, you may have a mark after acupressure. Be gentle with yourself, be gentle with others if you do this to others. But at the same time, try to kind of massage the point, stimulate it. This point is good as well to lower temperature. So this is the master point for that. The principal point I use for my daughter. I hardly ever have temperature, but when my daughter does, that's what I do. I press this point in combination with others, but starting with this point is good enough. Now we will switch to the other side and we do the same. So flex your arm, find the end of the transverse crease, and the point is here. I'm using thumb because it has biggest area that works on the point. So this way I'm sure that I am above the point and I'm pressing where I'm supposed to press. It covers the biggest area. But if you get tired, you can change and press using different fingers. So it's good principal point for lowering fever as well. The other indication to use this point is when we have skin issues like urticaria, or itchy skin, itchy whole body. It will help. Or shingles, it is helpful as well. The other thing is that in acupuncture we have so-called local points and distal points. So this is, every point is a local point to area that it's located at. In addition, this point activates the whole channel, large intestine channel. Please continue pressing, I will just show you. Large intestine channel, it goes like here, like this, and goes to the other side. So it activates the whole channel and relieves pain. Let's press and lift. Press and lift. Large intestine. Press and lift. Or let's press it for a while now. As I was saying, you can do this to yourself or to someone else, and it can be done to children. With children, in general, sorry, repeat. We'll move to the other point, and I will tell you about children. The next point to use is located between metacarpal bones, first and second. To find it, just press the thumb when it where is the joint, and just do this motion, slide it in, and the point is located right here. So if you are pregnant, This point is not indicated, so better not, you don't press this point if you are pregnant. There's no other indications. The other way to find it, it's located in the middle of second metacarpal bone, because it's closer to the second metacarpal bone. So you can locate it this way, closer to second metacarpal bone, and you are there. Press and lift, press and lift, press and lift. Or circular motion on one side, in the other side. As I was saying with children, the pressure we'd use would be very gentle. Like if we were checking if the cake we baked is ready, it's really, really gentle. Or when we finger paint, then it's the same kind of pressure that we would use on children. So with this point, if you are pregnant, don't use it. Press and lift. Press and lift. Press and lift. Circular motions. Try to stimulate the area where the point is located. This is so-called, we'll change the sides. So again, use your thumb and just slide into your hand. And the point is here. So this is the master point for head. Anything that is wrong on the head, this point will help. So any type of headache anywhere on the anywhere on the head, this point will help. It will help with stuffed nose, runny nose, with problems with eyes, toothache, especially of the lower jaw. It helps with ear problems as well. And it is indicated in problems that occur after stroke on the face. This point is the rescue, to the rescue. I would strongly recommend to press this point. If you only can, when you are, for example, commuting, you can do it so easy. Just fold your hands and you do acupressure to yourself, and you can help so many health conditions with this one point. And I can tell you that our bodies get used to acupuncture or massage, but it can be even called addiction, but I think it's one of the nicest ones. We are just getting used to, our body is getting used to what it gets, and it finds its way to work with it. Press and lift. This point helps with digestive issues as well. And regarding pregnant women, it's not indicated during pregnancy, but before labor, or if the labor is difficult or takes some time, please press this point. It will help. The next point we are going to press is located on feet. So I will try to show you. It's located between first and second toe, big toe and second toe. You just slide between them, and you can find depression there that you can press. Just slide between and you'll find depression. This point is called lever 3. It may be tender. Please continue pressing that if you can. Just showing on my hand. Just slide in between metatarsal bones and you'll find depression there. And just stop there and press. Not at the beginning, but farther. So between the big toe and the second toe next to it. So between big toe and here, just slide. Slide and press. There's the depression. Please continue pressing. So this point helps lowering high blood pressure, but it helps with anything that's related to stress. Different people react to stress differently. Some, for example, cannot eat. Some eat a lot. Some have constipation. The other have diarrhea. And you just, whatever it is with you that stress is causing in your body, this point will relieve it. This is the point that helps the chi, the energy in your body, to flow freely. This is very important because in the body that everything is open, the energy can flow freely. Sorry. It's healthier. Now let's change the foot. And now again, big toe, second toe, and we just slide between them. You can feel the depression there, I hope. If not, it's fine as well. You can't go farther between metatarsal bones. It's here. It feels uncomfortable to me, and it often does. It's sensitive. It's a very sensitive point. The other indications to use for this point, it helps with gynaecological problems related to periods. It helps in absence of periods or with painful periods. Just try to press the way you feel comfortable with. I like moving, like doing this when I'm pressing, but some people just press and keep on pressing all the time during the session. Do whatever you feel like doing. Press and lift, press and lift, press and lift. Or keep pressing. If you have strong fingers, you can just keep on pressing. This point and large intestine for the point we used before are so-called four gates. They help with pain anywhere in the body and with spasms. So by using these 2 points and the one located here, we are helping us to alleviate pain. We are moving to the next point. Next point is located at the back of the head, right under the skull. We used this point before when we were doing a webinar that was designed to help when we were coming down with something cold, something like a cold. So the point we are looking for now is called gallbladder 20. It's located here and here, yeah? Just to let you know where it is. It's here. So it's located between the sternocleidomastoid muscle, between this muscle, it starts, it goes behind the ear. So it's between this. If you rotate your head, you can feel the edge of this muscle. So it's right on the side of the muscle. The next muscle to it is trapezius muscle at the back. So the point is located right here. When you rotate your head, you can feel it better. That's why I'm rotating head. Once you find the point, it's right under the skull. Just press. This point is set to, the technique to press this point, maybe some suggest it's better to press it. Just press it all the time instead of changing the pressure or lifting and pressing. Just press. If you don't feel comfortable doing so, or if it's just too much, just press and lift. Press and lift. Any stimulation is better than no stimulation. So we know from previous webinar that this point is helpful when we catch cold, when that is accompanied, we will switch sides. So again, sternocleidomastoid muscle and trapezius muscle. Feel when this muscle, sternocleidomastoid muscle, ends, when it's the edge, and press right under the skull. So when we have a cold that is accompanied with headache, runny nose, stuffed nose, earache, or problems with eyes, like red eyes, we'll just press this point. It's good in such situations. It's good as well for any type of headache, anywhere on the head. It's good when we feel dizzy. This point works marvelously. So if you want to press and lift, please do so. Press and lift. Press and lift. This is another tender point. You may find it a bit difficult to press because it may be painful. My husband likes when I press this point when he's driving and I'm at the back. Or it's really like refreshes my husband. So it's just whatever we find the point is useful for, it is useful for. But the theory that we can rely 2,000, 3,000 years old is that it's good for lowering high blood pressure, for example. From my experience, it's good when somebody is driving a lot or it's a long drive. It's good to relax the person. The next point we are going to use is the point that we know from our first webinar. This one is additional point. it's located. If you please can make your hands like this, put your one hand on the other, right when where the wrist is on the edge of the wrist, like this, 3 fingers, and the point we are looking for is located right under the index finger, between the tendons here. If you make a fist, you can feel tendons around it. So that's the point. So again, place it on the wrist. There's 3 fingers, but the little one. And the point we are looking for, it's right under the index finger, in the middle, between the tendons. Please continue pressing this point. This is additional point. Sometimes we have high blood pressure because we had some kind of shock. We experienced some kind of shock, emotional, for example. So this point is additional. It will calm us down. It will help us help our chest, and this way it will help us to get back to our normal selves. Like if we have some bad news we just had, or we have palpitations, this point is a great one. In addition to helping with heart and chest area and calming the mind, this point is great for nausea. This is most famous point for pregnant women. We now switch sides. So again, we place our hand on the wrist with 3 fingers, and I was showing in a different way. Sorry. This way. And the point we are looking for is under the index finger. Yeah, we place the hand on the wrist, and it's under the index finger, between the tendons here. So let's press it. This point is called pericardium 6. So as I was saying, it's good for pregnant women because it alleviates nausea. And there's lots of nausea in pregnancy, especially in first trimester. About pregnancy, only yesterday I read on internet that acupuncture is not indicated in pregnancy. And this is not entirely true. So when I was pregnant, I had acupuncture every week or even twice a week. There are just some points that are not indicated in pregnancy. And hopefully the acupuncturist you are seeing is aware of that. We are trained to be aware of that, but you never know. It happens that sometimes acupuncturists, forget, or I can't imagine. I just know that sometimes they do make such mistake that they use the wrong points for pregnancy. It's absolutely safe to have acupuncture, and there are some points that are especially good for pregnant women, but there are some points that are not indicated in pregnancy, like the one we tried before, large intestine 4, located here. So please continue on pressing, press and lift, press and lift, press and lift. Oh, we are running out of time. Please continue pressing. I hope you liked the session. I will go quickly through the points we had. So we had large intestine 11, located at the end of the crease. We have large intestine 4. It's not indicated in pregnancy. We tried liver 3 between the big toe and the next toe. We slide between them, between metatarsal bones, and we press here. The next point we tried is located under the skull, between the sternocleidomastoid muscle and trapezius muscle. And the last one, the additional one, it's located below above the wrist. When you place your hands like this, it's located right under the index finger, in the middle between the tendons. Thank you all for participating, and please attend again. If possible, and if you like the session, please support the charity's work. I hope you enjoyed the session. I strongly advise you to practice this treatment and stay in touch with your GP, and have a lovely weekend, everyone. Thank you for being here with me.